Hello, my name is Eric Adams. I am the Brooklyn Borough President. It has been my honor to serve you as a New York State Senator and now as your Borough President. As part of our ongoing efforts to engage the public and shed light on the process of government, it is my responsibility to foster civic participation and education in Brooklyn. Today, as we focus on an issue of great importance to Brooklynites, the future of Long Island College Hospital. This is more than a medical facility. This is and has been a community institution in Cobble Hill and the surrounding neighborhoods since 1858. Litch is in financial crisis, and many of the issues it faces are also challenging facilities like Brookdale Hospital, Interfaith Medical Center, and SUNY Downstate Medical Center. This has posed a large healthcare issue, emergency for our entire borough. Brooklyn needs greater financial support from our partners in government, especially on the federal level, to address this situation. Additionally, we as Brooklynites need to have a transparent, comprehensive, and adult conversation that evaluates, addresses, and prioritizes the larger healthcare issues of our borough. The road we are traveling is not sustainable. We must fight to preserve that which is successful, just as we must fight to revise that which is not. Today's broadcast is an important step and part of our larger borough-wide conversation. I want to thank BRIC and Brooklyn Independent Media for coming together and cooperating with me in a short time frame to put together this community engagement opportunity. You are about to hear from the 5 proposals that were resubmitted to the State University of New York through its request for proposal process for the future of Litch. The proposals comprise of 5 individuals, which the first is Brisa Builders, in partnership with the Cobble Hill Integrated Healthcare Incorporation, comprised of Lutheran Medical Center and Allura Healthcare Incorporation, and the Chetrit Group. The second proposal is the Brooklyn Hospital Center, together with Blue Wolf Capital Fund, 3LP, and related companies. The third proposal is the Chinese Community Accountable Care Organization, partnered with the Eastern Chinese American Physicians, IPA. The fourth is Fortis, partnered with NYU Langone Medical Center and Lutheran Family Healthcare Centers. And the fifth is People's Corporations. Following their presentation, I will moderate a short question and answer session, which has been fueled in part by emails and tweets you have sent me. I encourage you to continue emailing me at askeric@brooklynnp.nyc.gov or tweeting at BP Eric Adams with the hashtag LitchQ&A with additional questions and comments you may have. I will post them on my website, and I encourage all of today's participants to respond to them. As indicated earlier, my goal with this effort, which is independent of any such efforts by SUNY or any other stakeholders, is to advance the transparency in this process and to provide one avenue for community input. It should not be the only avenue. This broadcast organized in a short time frame, which does present certain challenges, and we are aware of that. I understand and appreciate the concerns and frustrations of local residents and others invested in this important issue of the future of Litch. Keep in mind that this broadcast is aimed at you and engaging you. Please share the information you gain here with your family, friends, and neighbors. Also, let my office know if we can improve efforts like this in the future. That is the spirit of the One Brooklyn concept that I embrace so much. We seek to create togetherness. With that, let's proceed with the presentation. And I thank you, Brooklynites.
Good afternoon. First, I'd like to introduce myself. I'm Don Peebles. I'm the Chairman and Chief Executive Officer of the Peebles Corporation, here to represent our team. I have Neil Kalman of the Institute for Family Health with us as well. And I want to thank the Borough President for giving us the opportunity to present our proposal in a transparent manner and allowing himself and his staff to get all of the information before making a decision of recommendation. We, as a company, thought long and hard about whether to even bid for this opportunity because this is a precious resource of the community, and we were very well aware of the controversy surrounding it and the competing interest between the state and the local community. However, we became convinced that ultimately the state was going to put this property to a new use, and therefore we felt we needed to be a part of the process because we felt we had the best solution once the decision's made to actually close the hospital, and we offer a good solution. Our goals are to meet the needs of the healthcare industry with improved access to affordable primary and preventative healthcare, provide quality, affordable, and market-rate housing for the neighborhood for a wide range of ages and income, and assist downstate exit by having a seamless transition from the hospital perspective to the Institute for Family Health, and build a socially responsible and economically feasible development. Our team is an all MWBE team, and we bring the best and the brightest from around the United States and New York City to bear. Our company, the Peoples Corporation, is America's largest African-American owned development company in the United States, with a portfolio of over $2 billion of development in projects in New York City, Miami, Florida, Washington, D.C., Las Vegas, Nevada, and San Francisco, California. Our financial partner is McFarland Partners. McFarland is the largest African-American owned real estate private equity firm in the nation. They've managed as much as $20 billion of assets. They currently manage over $5 billion, and they're credited with the development and financing of the AOL Time Warner Center, 15 Central Park West, and several developments right here in Brooklyn. Our co-developers are BRP companies run by Meredith Marshall, and Danbar Development run by Dewana Williams, all MWBE firms that are excelled in their skills. Additionally, we have the Institute for Family Health, and they will, Neil will articulate their vision for providing the needed health care within the immediate community and all of Brooklyn as well. Architectural design by Dadner Architects, tremendous experience here in Brooklyn. Our construction manager is McKissick & McKissick. They are America's oldest minority construction company and have a tremendous platform here in New York City and New York State, done quite a bit of business with New York State as well. And we've studied this site on a land use perspective through Kramer Levin as our land use attorney. I would like to tell you a bit about our project. We have, the city of New York faces challenges. Affordable housing is its #1 challenge. Access to good quality education, another primary challenge, and also equal economic opportunity. We can't stop this income disparity until we have economic opportunities for wealth generation and business opportunities across the board, and our development team reflects the cultural and ethnic diversity of the community that we're developing in, or we propose to develop in. Our project is for affordable primary and special care for the community health care, targeting medically underserved communities, and we're building up to a 50,000 square foot center. Affordable housing of up to 35% affordable housing. Renovation of existing buildings so we preserve the character of the neighborhood without disrupting it with massive new construction. And in addition to that, we will be able to phase in the project's development and restorations quickly and seamlessly. And then we had offered the state the first new pre-K education center in New York City, where we would build a high-quality public or charter school up to 40,000 square feet. And we're prepared to still build that. The state asked us to focus on the healthcare issue and also the development of our project. So we are still willing to do healthcare, and we think that is an important aspect. I'd like to turn it over to Neil Kalman to discuss the Institute for Family Health.
Thanks, Don. My name is Dr. Neil Kalman. I'm a family physician, and I am a co-founder and president and CEO of the Institute for Family Health. We are an organization that focuses on 100% access for people in the community to state-of-the-art primary and preventive care, acute care, and urgent care, all of which we provide through a network of almost 29 centers extending from Kingston, New York, all the way down to Lower Manhattan. We also are a training facility. We train medical students and we train residents in our facilities to help support the supply of physicians for the future. Our centers all integrate both mental health services, dental services, and primary care services, and I'll tell you a little bit more about them in a moment. Our services are supported by 65 separate grant programs we have to make sure that we have funding to meet the special needs of all of the special populations that are so prevalent in New York. And we work in partnership with community health centers, other community health centers in the city, 1199 and other entities all through the city, multiple hospital affiliations, so that we can make decisions that are in the best interests of each patient that comes to us. Last year, we did that in over 600,000 patient visits, each one individually assessing the patient's needs and committing to high-quality services. Next slide. So our services are primary and preventive care. We do full-range reproductive health care, including prenatal care, and our doctors deliver in a number of hospitals. We care for people with all kinds of chronic diseases. We ran the the New York State Diabetes Campaign for a number of years and specialize in the care of people with HIV disease and heart disease, diabetes, asthma, and others. We provide a full range of mental health services, all on an outpatient basis, provide dental care, as you'll see in a minute, and have a WIC program, urgent care facilities, and most importantly, we operate on an extended hour so that our centers are open from 8 a.m. to 10 p.m. every single day, 7 days a week, 365 days a year, even in this kind of weather. And on our doors, it says, no one is ever turned away. And we mean that. We never, ever turn patients away. Whether their insurance, we take their insurance, we don't take their insurance. It's been a principle of ours for 30 years. We have multiple hospital system affiliations, depending upon where our hospital partners are and where our patients choose to go, where we can get the best health services for each of our patients when they come to us. We're prepared to do here what we did when North General Hospital closed in Harlem, and that is we stepped into a facility that provided acute care, that had emergency rooms, that had inpatient beds, and working with the New York State Department of Health, Department of Mental Health, we transitioned services so that no people were left hanging. What that meant for us was that we had daily phone calls with the health department. We had ambulances sitting outside the facility for months to make sure that nobody, by mistake, came in with an acute problem that needed to be transported to a hospital. To this day, only 1 year after our new facility opened in the neighborhood there, we are doing more visits on a primary and preventive basis, more visits than the emergency room did, than all of their ambulatory care facilities did. And that's a result of offering people in the community the services that they need. We can immediately file for licensure under Article 28 and Article 31 to be licensed as a mental health and also primary care facility to take over the services that are there. Our services will be open in the evenings, and our services will be available to everybody that walks in the door. We did a massive retraining program. Our services are all computerized. People who come to the Institute have an electronic health record that is accessible to them through their iPhones, through their computers. They can communicate with their providers. It is state-of-the-art healthcare. This is a picture of the facility that we built in Harlem. It's become a showcase now for the Harlem community. Our entryway, beautiful, all glass. This is the kind of first-class facilities that we build, that we're going to build with Don, because we believe that the facilities reflect the respect that people have to have in the community. And with that, I'll turn back over to Don.
Thank you. And just in closing, sustainability is key. We don't want to be at this situation again a few years from now, so our company is financing 100% of the project cost and will turn over a debt-free facility to the Institute for Family Health, and they will operate within the Black consistently. So thank you very much. I want to close out by indicating that we have the healthcare focus. We are providing affordable housing. We're prepared to provide educational opportunities, and we are transformational to the fact that we're an all MWBE team with the financial capacity and proven track record to perform, and have done countless public-private ventures, but all members of our team have done that, including us recently with the EDC of New York City. Thank you very much.
Hi, good afternoon. We have with us today our chairman, Louis Kestenbaum, and our president, Joel Kestenbaum. Kestenbaums are born and raised in Brooklyn and have used the Litch Hospital numerous times. We developed our proposal with input from many healthcare experts, community groups, and local leaders. The evaluation committee of SUNY's Board of Trustees ranked us the highest of all the bidders back in December. After SUNY ultimately tabled that decision, we continue to meet with the community groups, the local elected officials, the unions, to get their feedback and to enhance our proposal. As a result of that feedback, we feel that we've developed an even better proposal with the best possible healthcare providers with NYU, Langone Medical Center, and Lutheran Family Health Centers. And we've also got other aspects of our proposal that we think make it the strongest out there. So first, NYU Langone Medical Center will, as Dr. Andrew Brotman will explain, will be running a freestanding emergency department and deliver comprehensive primary and multi-specialty healthcare services. Dr. Andrew Brotman is the Vice Dean and Senior Vice President of Clinical Affairs and Strategy at NYU. And Dr. Brotman is probably too humble to say this, but I think most of us know this already, that NYU is ranked consistently among the best hospitals, not just in New York City, but also in the country. As I mentioned, we have Lutheran Family Health Centers as well as part of our proposal. They're one of the largest federally qualified health centers in the country, and we're happy to have Larry McReynolds, its president, here with us. As further evidence of us incorporating stakeholder feedback and comments into our proposal, we will also be joint venturing with L&M Development Partners to deliver 25% affordable housing as part of our residential component. With us today is the CEO and chairman of L&M, Ron Mullis, and he will be describing that aspect of our proposal. Reflective of how our team has worked with the community groups and the leaders and incorporated our feedback, their feedback, and how we've gained their support through this process, we have received numerous letters of support from resident leaders, local clergy, and we're very honored to have the support of Assemblyman Joseph Lentil, the chairman of the Brooklyn delegation. And with that, I'd like to turn it over to Dr. Andrew Brotman to discuss NYU's healthcare services.
Next one. Okay. Good afternoon. My name is Andrew Brotman, and I'd like to tell you a little bit about the healthcare services that we and Lutheran Family Health will be providing at this site. First and foremost, we propose a 24-hour freestanding emergency department with observation beds, which means that we can accept ambulances. It's the highest level of complexity that the DOH will allow, and we will have the capability of having patients stay up to 23 hours through the emergency beds. We will have transfer relationships with Lutheran, other Brooklyn hospitals, and ourselves if there is levels of care that are not available here. We will have urgent care co-located with the freestanding emergency department. We will have a cancer center, which I think is an unusual part of this. We have a National Cancer Institute designated cancer center. There are only 68 of them in the United States, and we're proposing having a branch right here at the site of Long Island College Hospital. We will have an ambulatory surgery center with 4 operative suites where we'll be doing general surgery, ophthalmology, gastroenterology, otolaryngology, orthopedics, and other surgical procedures. Additionally, we'll have a robust group practice that will have internal medicine, cardiology, pulmonary, gastroenterology, rehab, urology, and other services that will serve the community. This will be accompanied in total by diagnostic imaging and radiation oncology. So we think that in this 60 to 70,000 square feet of space, we'll be able to provide very robust ambulatory care. I will point out that we've done this before, with the exception of a freestanding ED, which is a new concept. Every other type of service we have, we can give you 3, 4, 5 examples of where that is in the boroughs or in Manhattan. Next slide, please. Okay, technical difficulties. We are partnering with Lutheran Family Health Center. Lutheran, represented here by Larry McReynolds, actually operated a dental clinic at Litch during that period of time, and they will help with a federally qualified health center. We will partner in primary care, pediatrics. They will do dental and behavioral health, and as such, we'll have a very robust suite of services. Thank you.
So I'll just step in because I think we only have about a minute. So my name is Ron Molis. I'm the CEO of L&M Development Partners. We have, I'm going to focus on what we've done, over 15,000 units of affordable housing in the city of New York. But more to the point of this community, we worked in the past few years developing an interesting mixed-use, mixed-income building in a couple blocks away on some sites that were either city-owned or Litch-owned. We worked with the local community board closely, the local council member, and previous to this council member, the current mayor, who was the council member before that. We were able to work well in not only creating a development that had 40% affordable housing, 60% market rate, but also one that was designed and had density and height issues that we worked with the community board, with local members who were in the architectural design aspect of it, and we were able to come up with a plan that included, that was very comprehensively appreciated by, I think, all the members or most members of the community and the local electeds as well. We intend to do the same kind of thing with Fortis and NYU and Lutheran here on this site as well. Thanks.
If we have time yet left, I'll just describe a few things very quickly that we've put into this for the community. One is a community foundation. We're going to be contributing $5 million to that for various benefits to the community. We'll be making grants and investments for community health, affordable housing, and social services. And then finally, as reflective, I think, of our proposal, we've got a big community engagement and outreach program so that we didn't just talk to the local elected officials and the community groups before our proposal. We've set up a framework to continue to do that throughout this entire process and after we start operations there, the healthcare operations.
Hi, good evening. Thank you very much for inviting us to present. We appreciate very much this opportunity. I am Josephine Wu. I am the administrator of the Chinese Community Accountable Care Organization. Our group also encompasses the Eastern Chinese American Physicians IPA, and we are very excited to be here to share with everyone our vision for Long Island College Hospital. First and foremost, our plan is a simple one. Our plan is to provide a full-service hospital at Litch. We are not developers, by no means. We are physician groups and very successful physician groups, and our focus is providing medical care, and that's what we are passionate about, and that is our focus of our proposal. And we are very open and willing to collaborate and want to collaborate with the community stakeholders to provide them with the right size hospital services that they would like. Continuing with the presentation, I'd just like to further introduce our groups. We're a strategic partnership between CCACO. CCACO is one of the first accountable care organizations approved in April of 2012. We were nationally recognized at the end of last year by receiving, being one of the 29 ACO selected for shared savings. So that to us indicates that our accountable care organization is able to efficiently manage patients, and we understand how to manage the health care of patients in the community. Also, our partner, the ECAP IPA, is also a group of over 200 physicians and was established in 2004. So overall, we represent a large network of clinically integrated physicians who are motivated and dedicated to provide healthcare services to the community. What we'd like to do is outline our vision for a high-quality, low-cost hospital and healthcare solution at Litch. So our hospital vision is simple. We'd like to establish a non-for-profit Article 28 hospital on the Litch campus. We'd like to work with community leaders, community groups, and all community stakeholders to determine what is the right size hospital that they would like and the right services that they would like. We'd like to meet the healthcare needs of the community. Again, we're physicians and want to provide healthcare and want to make sure that what the hospital that we can provide meets the needs of the community that Litch will serve. And then moving on to our management vision, the management team will be led by community-based physician groups that are owned and managed by physicians who really understand the needs of the patients and what their needs are. And really, being an accountable care organization, we are really right in the forefront of healthcare and the changing landscape of healthcare. We understand with Obamacare that change is needed in the current healthcare landscape. That's why there is healthcare reform and why there is accountable care organization. So really, change is a must, and we really think that we can provide an efficient new way of healthcare with our vision, and we want to work again closely with the community and the Litch physicians to be part of to change the landscape of healthcare for the better. And we are working very closely with very key and experienced hospital executives to manage the daily operations of the hospital. And we also understand that there's a need for an academic vision at Litch. We're all trained through the residencies and see that there's a need to continue the training of skilled physicians, and so we have an academic focus as well, in which we're willing to affiliate with hospitals at Litch and work with our physicians to again provide medical residency training programs to ensure that there's a continued path for new medical professionals in healthcare who are skilled and adequately trained. And then finally, our financial vision. Our proposal for a full service hospital is funded by the team of Rudy Washington and John Katzmatidis. The final details are still being worked out, but what our focus is that they have agreed to fund our proposal and to provide the right-sized full-service hospital at the Litch campus. So to summarize our distinct advantages and strengths of our proposal, we are a group of experienced healthcare providers who really understand the needs of the community and healthcare. We have local affiliations and relationships. We have a large patient base and physician base within the local community of Brooklyn, and also collaborative relationships with local community stakeholders and groups. And so we are also very successful in managing physician organizations such as our ACO and our IPA. So really, our strength is healthcare and patient health. So in conclusion, to summarize our very simple plan of providing a full-service hospital to the Litch campus would be that we want to make sure that it's the right size, the right service, the right feel for the community. We are very willing to collaborate with community groups and community stakeholders to make sure that that is what the community wants. Our goal is to provide the community with regards to healthcare with what they are looking for. And that is our vision and what we are passionate about. We are providers of healthcare services, and that is our vision. And we're here to, and willing to, in the next steps, work out the finer details, but our overall plan is to rebuild and restore a full-service hospital to the Litch campus, and will be with a debt-free hospital facility. And we really believe in that proposal, in that plan, and we believe it's the most simple plan. And so we'd like to thank you very much for the opportunity to present our proposal, and thank you very much.
Thank you. I'd like to thank the Borough President for hosting this forum. I'd also like to introduce myself and say I'm Dr. Richard Becker from Brooklyn Hospital. I'm a physician and the CEO of the Brooklyn Hospital Center, and it's a pleasure to be here today. I also want to thank you, Mr. President, for selecting me as a chair of your Healthcare Transition Committee. It's been a real terrific opportunity to help you shape the vision that we have talked about for months, and quite frankly, that we've been working on at Brooklyn Hospital for many years. And that vision is really to transform healthcare in Brooklyn. It's been an opportunity we've worked on for a long time, and now it's the time to act. So we're excited and thrilled to be here. We want to walk you through our proposal, which is really unique in that it's a made in Brooklyn proposal. We spent many hours, much time focused on thinking about what the issues are that face Brooklyn in general and the Litch community specifically. It's centered on the community. It focuses on what we're doing now, which is delivering great care through our hospital, through our expanded and distributed healthcare network with our fine physicians. We've developed our proposal after a great number of discussions with elected officials, with the community, with unions, and many, many others, our community provider network, and we feel very confident that we have the right solution for what has been a very complicated issue. We're aligned with national trends towards population health strategies, and again, we are not doing this alone. We've been consulting with Mount Sinai Medical Center that has great expertise in operationalizing and implementing very complicated healthcare situations. We want to talk a little bit about the three legs of our proposal. First is an expanded Brooklyn Hospital network will improve the Litch community's health. And that's the key to all of this. You can see that right now we have 22 different locations, us and our partners, that deliver care to over 275,000 people in our primary and secondary service areas throughout northern Brooklyn. We propose, through a series of steps that we can talk about, adding 5 new healthcare centers to the Litch primary service area. We propose to increase that to 31 sites that serve over 375,000 people with the ability to expand. The second piece or second leg of our proposal comes in with responsible housing development and a significant portion of affordable housing. We really want to balance maximizing the value of the property for SUNY with developing it in a responsible way that includes maintaining the existing density, significant affordable housing component, as well as the right space to deliver the appropriate medical care. And third, and really important, is to maintain the commitment that we have and that we've talked extensively about to the many, many committed healthcare professionals and staff that have been at Litch providing great care to their community. We want to make sure that through the new facilities we develop and through our own existing facilities, as well as those of Mount Sinai, that we really offer preferred hiring and have a plan so that those people who are working at Litch are really disrupted in as little way as possible. And we want to bridge them to continued work to do exactly what they're doing, which is delivering great health care. We just have to give them back the opportunity to do that, and our plan does a great job of that. Our partners, we believe, are unparalleled and very unique. We are really unique in our ability to leverage what we're doing in Brooklyn as a hospital, as a medical center, as an ambulatory care network. Our roots are deep in Brooklyn. Our partner, our healthcare partner in this, in delivering care, is ICL, that has a marvelous reach in delivering behavioral health care. And then our partners in the rest of this include, as I mentioned, Mount Sinai Medical Center for its operational and implementation guidance related, which we'll talk about in a minute, but is unparalleled as a development partner and reputation in New York, and a marvelous reputation and experience in implementing affordable housing and working with the community, and our capital partners, of course, Blue Wolf, that also have an amazing record of developing projects throughout the country. This is supported, of course, by broad community support. It's no coincidence that we had an open letter from Senator Montgomery, and that letter, I might add, was not arrived at off the cuff during a short time. Senator Montgomery has worked with us for 2 years in thinking about and helping us develop an approach towards health care in Brooklyn. And her letter and her open support is a result of much thought. So we're grateful for that, as well as our many other partners. And I want to also thank Lizetta Duncan-Moore and Dr. Earl Byer, who are the CEO and medical director of Brooklyn Plaza FQHC, specifically for being here, and thank you for your support. But you can see we have a lot of homegrown Brooklyn support. Our healthcare network, our healthcare indices, we've studied very carefully. It's important to know and understand that we really know this community well. This community is our community, and we are delivering care to them at this point in time. You can see the issues that we've identified and the solutions that we already have in play. This is simply a matter of extending what we're doing now deeper into the Litch community. Just to show you our network, you can see this is who we serve right now. The large dotted line is our primary and secondary service areas, and the circles are our existing sites, supported by what we add on. You can see Litch and the center that we plan for Litch, followed by the school clinics that we would continue to maintain. The primary service area of Litch is identified in a red dotted line here, and you can see it's well within the scope of where we provide service. Mount Sinai's active multi-specialty practice in Brooklyn Heights, 70,000 square feet of practice, physicians, multi-specialists available to our network. And finally, a series of urgent care clinics and primary care and specialty clinics that would reach deep into the Litch primary service area. So we believe that visually, this really tells the story of the extension of our existing network that we're proposing as the healthcare solution for Litch. More specifically, 5 new healthcare centers, First one is a comprehensive care center with a freestanding emergency room that is 24/7, 365, receiving ambulances, and the ability to quickly move patients who need more serious care to Brooklyn Hospital. This can happen immediately because we're only about a mile away, which is a huge convenience for this center. We also plan some other services on site: ambulatory surgery, endoscopy, dialysis, and physical therapy. But I want to emphasize that we want to have a continued dialogue with the community of Litch, in and around Litch, to make sure that we're putting in services that the community wants and will use. And this is a critical part of what we do. Our satellite clinics will be 2 urgent care clinics at least, and another 2 primary care clinics. Those will be focused more on the service area around Litch, reaching into the Red Hook area specifically, so we're very clear about that. Just a word about related companies. Their experience, as I mentioned, is unparalleled, and just to focus on one line, their amazing and unwavering commitment to local communities and creative problem solving with relevant stakeholders is unparalleled. They go in and work with the community in a very detailed way to understand well and deliver something that the community can be proud of and really fits well with the community they're in. Again, the responsiveness is important. This whole process is a question of balancing, achieving maximum value for SUNY, developing in a responsible way the area around Litch, the Litch site, and also making sure that within that development there is very good health care that the community will access and use. It's interesting to note, and it's important to note, I believe, that the current zoning allows only 50% of the site to be rebuilt as housing, reducing the value significantly. This is a critical point, and we want to make sure it's understood. Attaining full market value for SUNY requires a rezoning to a R7X in conjunction with a large-scale development project and a ULURP process, which is familiar to many. But once that's done, we are prepared to move forward swiftly and negotiate an agreement within 90 days. The other piece of this is the superior financial strength. Related is a company that can and will deliver the commitments they make. Just to give you a time frame, as I mentioned, we're prepared to move forward very quickly. That means that the health care that we promise will be continuous. We'll be ready to move with the different pieces right away. The development process will start hitting the ground quickly. This will all be done in conjunction with a dialogue with the community to really inform the process. So finally, the essence of our proposal is keeping Brooklyn healthy and that we're made in Brooklyn. We've got to make sure that what we're doing right now continues. There's no reason for us to look further than right here in our backyard. We're doing a great job of delivering care now. What Brooklynites really want is to be able to access their Brooklyn doctors with a system that they know and trust. Thank you.
Good afternoon, Honorable Adams and audience members. My name is Erica Keller-Walla. I am the principal and owner of Brisa Builders Construction Corporation. I am truly honored to be here at Borough Hall presenting a vision for the future of the Litch campus. The fact that I stand here is truly, truly the epitomization of the American dream. How often do you get a mother, a professional, a woman born and raised in Brooklyn is given the opportunity to share her vision of a healthy community with well-established real estate developers who buy into that vision of what is needed for the community. I truly have a heart for the community. I come from the community. I remember attending the Atlantic Antic every year, and I really want to be a part of not what everyone is talking about, the end of Litch, but really about the beginning. And so I'd like to share with you our vision for a healthy community using the repurposing of the Litch campus as a platform for developing a model community in Brooklyn, New York. So my company, Brisa Builders, has been supported by the Citrec Group and Cornell Management, Realty Management, along with medical providers to support our mission, which is to create a fully integrated healthcare system offering state-of-the-art healthcare and ancillary services, along with a complement of housing, retail, early education, recreational opportunities for the Brooklyn community. The tenets of our approach are we are working arduously in negotiations with a full continuum of medical services from a leading healthcare provider. This program also supports promoting healthy living. So we are proposing to have physical fitness centers, gardens, and bike trails in the Litch campus area. We are also really focused on economic development. We plan to expand employment opportunities in Brooklyn with the creation of construction jobs, as well as the retention of health care for 1199 and nurses. We also hope through the retail opportunities that there will be employment there, as well as early education and elderly services. We also propose creating a community advisory board in order to help with the redevelopment of this project to get input from the entire community. So we are currently in negotiations with North Shore LIJ. They have expressed an interest in providing a freestanding emergency room for the Cobble Hill area as well as the surrounding neighborhoods, where we would have fast-track urgent care. There would be an observation unit. In addition to these, we would have a long-term acute care hospital provided by Allure Care. It would be a 100-bed facility that offers a platform for patients who are too sick to be in a nursing home, but it's just not economically feasible for them to be in a hospital setting. This would be one of the few LTACs in the downtown or downstate area. There are quite a few upstate New York, but this would give an opportunity for patients in the Brooklyn area to have a place where it best meets their needs and their families would have access to them. We're also offering a multi-specialty medical arts clinic mall, an ambulatory surgery center, emergency transportation services, a skilled nursing and rehabilitation facility, 100 beds, with Allure Management again to service the geriatric community. And Lutheran has expressed an interest in possibly opening an FQHC dental clinic. In addition to providing a full-service medical program, we also are offering residential opportunities to the Brooklyn community. We propose at this juncture, contingent upon rezoning, about 1,000 units, with 30% of those designated for the people of the community. We're looking to support veterans and seniors, as well as other subsidized programs. The retail development, we want to offer a complementary services such as a pharmacy, physical fitness center, food, market, and shops, all in support of that healthy community. Last but not least, we are in full support of the mayoral's agenda as well as the White House agenda in the pre-K initiative, and we would like to offer an early childhood program on the Litch campus, as well as additional support, as mentioned previously, for the elderly with a skilled nursing rehabilitation training program. So our timeline, we would propose, once we are able to finalize negotiations with North Shore, a fairly immediate implementation of the ER room, and the entire project, we would speculate about 24 months for total completion. As earlier mentioned, we are very interested in the economic development of Brooklyn, and we are offering, through our program, a minimum threshold of 200 direct construction jobs, indirect procurement, supplies, contract preferences offered to local companies, which would result in additional jobs. We're seeking state approvals that will result in retention and retraining of 700 employees. For the LTAC, which is a 100-bed facility with 250 employees, for the skilled nursing facility, which is a 150-bed facility with 200 employees, and ER, observation, and clinics, all projecting 250 employees. So in comparison to what has been publicly released about the other bidders, our proposal triples the number of healthcare employees on site for $11.99 and our New York State Nurses Association. We envision a model health community. It's far and few in between that you have large real estate developers, owners of the Sears building in Chicago and the Sony building in New York, listen and say, this is a unique situation. No, we're not coming in and building condos and high-rises as everyone is speculating. No, we're going to be responsive to the community and we're going to do the right thing. And we're going to listen to a mother, to a professional, to a girl born and raised in Brooklyn. And we're going to give her some input in making those decisions for a community that she is connected to, that she has a heart for. It's far and few in between that happens. And this is an opportunity for us to work together as a community and do the best thing, not talk about endings, but talk about great beginnings. We're in negotiations with one of the most respected, prestigious healthcare systems in the world, and we want to bring that to Brooklyn. We are in negotiations with a local hospital who would provide trauma center and is interested in providing dental support for the community. We are in negotiations with a provider that has beds and realizes that there is a need specifically for long-term acute care in the downstate area, and they are willing to provide that to our community. This is a great idea. We want housing for our veterans, for our seniors, other subsidized programs in the Cobble Hill area. We want jobs. We want economic development, and we are proposing to do this for the community. And I emphasize, it's very far and few in between that you have developers who are listening to the people, who have partnered with the people to make a change. Brisa Builders, the Satrique Group, Cornell Management, possibly North Shore LIJ, Lutheran Medical Center for Trauma and Dental, and Allure Management. We are the team. We are about community. Thank you.
At this time, I will moderate a short question and answer session, which has been fueled in part by emails and tweets that members of the community have sent to me. I encourage you to continue to email me at askeric@borough.bp.nyc.gov, or you can tweet at BP Eric Adams with the hashtag #LynchQ&A with additional questions and comments that anyone may have. I will post all of your comments and topics and submissions on my website. We haven't addressed in this broadcast anything that we may have missed. You can send it over, and we will attempt to, as best we can, have it included in the final package. I strongly encourage all of today's participants to respond to the questions that we sent over. I now would like to invite representatives from each of the 5 proposals to answer a few questions that we have received already. Please keep your responses to 30 seconds. We would just like to get to the heart of the matter so that we can ensure that we get as much information as possible out to the public. First question, and we would just do it in order that we have, sent in by bknative201@aol.com. His question is, how would the proposal that you are presenting impact the nursing homes and long-term care beds at Lynch in the Cobble Hill health area and on the Henry Street area?
We would work in tandem, so we are proposing an LTAC as well on the campus for 100 beds for patients in need of this particular type of service. We are also offering a skilled nursing facility as well. So we would work in tandem with those that are already established in order to ensure that we are offering the best and the most for both the geriatric and acute care patients.
We currently at Brooklyn Hospital provide support and care for long-term acute care patients in Cobble Hill right now at the Cobble Hill Nursing Home. We would continue and expand that support. We're excited about that. We would not propose new beds be added to the Litch site. In fact, we don't see beds in that hospital as a healthcare delivery system. However, we are providing a tremendous amount of medical direction to geriatric patients really throughout the borough of Brooklyn and specifically in Cobble Hill.
For our group, we understand that the long-term care of patients is really an important part of the overall management of the patient. So what our goal would be to, again, collaborate with community groups to discuss and determine the level of service to decide what would be the best interest for the community. So our position is that we would work with the community to just make that determination to decide what would be the best at the Litch campus. Thank you.
So we have our medical healthcare partners, NYU and Lutheran Family Health Centers, have a robust set of services, including for geriatrics. We have also set up a framework for advisory panels and a foundation, which will be funded with $5 million, to help facilitate ancillary services. And if the community groups through those vehicles decide that that's something that's needed, that's something that we can explore at that time, but we've got that framework set up.
Our plan provides for the Institute of Family Health to operate a first-class, state-of-the-art medical facility with comprehensive medical care across the board for all residents, regardless of their ability to pay or not. And one of the things that we're going to do is make sure that it is sustainable by investing $50 million in turning that facility over to the Institute for Family Health free of charge, so they won't be burdened with the capital cost. And they will deliver those services to all residents and they focus very heavily on chronic illnesses, chronic diseases, and they will do that and continue to do that for geriatrics in this community as they've done it across the state.
Second question, and we start with you, Mr. Peoples. How many jobs will be maintained and how many will be union jobs?
All of the jobs will be union jobs. That's from beginning to end. We are looking forward to a partnership with 1199. We already have a partnership with the Hotel Trades Union in multiple jurisdictions, and we will work with them and the Building and Trades Union and 1199 on this project. We will create over 2,000 construction jobs will be generated by this project, and at least 200 permanent jobs on site, all of which will, any healthcare jobs will be 1199 jobs as well.
Our proposal has 500 approximately employees on site at the Litch campus. Of those, approximately 225 per our existing estimates will be union employees, the majority of which will be 1199. And as part of our proposal, we also have that the Community Foundation that I mentioned, which could fund and help with a jobs training program as well.
Our program focuses on creating a full-service hospital, so we absolutely will have new jobs created, and we will certainly collaborate with the unions to provide jobs for nursing, allied healthcare, and staff at the hospital. However, because we haven't determined the best size of the hospital, the absolute number hasn't been determined yet, but we absolutely understand that we will be working with the unions for that, for the job. Thank you.
The Brooklyn Hospital Center is currently and will be an 1199 and NISNA employer. We have terrific relationships with both the unions and have worked collaboratively in actually developing our proposal that you saw just a few minutes ago. The healthcare facilities that we've spoken about will employ approximately 200 1199 and NISNA staff, and we'll have an additional 25 nurses from NISNA that will be new employees currently working at Litch to help us with our population management, health management efforts.
So commencing with construction, we propose a minimum threshold of 200 direct construction employment opportunities. Indirect, with procurement and sales and contracts, we are giving preference to the local community companies for those opportunities. In reference to the healthcare providers, between the three facilities, the ER, the LTAC, long-term acute care hospital, and the SNF, skills nursing facility.
Question: how many luxury condominiums and affordable housing units will be built in with your proposal? And we'll start with you, Dr. Becker.
Well, thank you, Mr. President. I think that there's going to be a significant amount of affordable housing. This really takes working with the community to determine the right amount of affordable housing and the right amount of market value housing. I want to emphasize that Related is not building luxury condominiums. We are building market value housing, which is important to note, and that the density will be respected, the existing density will be respected. So we believe that Related, in close consultation with the community, will develop the right housing solution for the property at Lynch.
Oh, thank you. Regarding to the amount of housing, I will say first and foremost that we are healthcare providers. So our focus is on healthcare, providing a hospital, but certainly our funding source, the team of Rudy Washington and John Katzimatidis have a real estate development plan. Certainly involves housing, but as to the details, it's hard for us to say at this moment, but certainly a housing component will be involved. Thank you.
Thank you. We are committed to 25% affordable housing, and to bring that to fruition, we've partnered with L&M Development Partners, which is one of the most well-respected affordable housing developers in the city. In fact, they've developed a project very close to Litch called Columbia Hicks. They've worked with Community Board 6 and all the various community groups, and I think everyone thinks that that's an astounding success, and the game plan would be to bring them in to Litch to do something very similar.
Yeah, I'm glad. Great question, because we've been focusing on healthcare, but this is a resource for the entire community of Brooklyn, and there are other needs. And one of the most competing and strongest needs of the community right now is affordable housing. But we can't have affordable housing separated and isolated. We need to blend it in and have our housing development reflect the diversity, the income diversity of our community. We propose to build up to 1,000 apartments, of which 350 of them will be affordable housing, and they will be blended in and developed throughout this complex. We will build and redevelop on the existing structures, so we will minimize the negative impact on the community during construction in terms of cranes and the like, and also we'll be able to promptly phase in our development. And we have 3 development partners, all local MWBE development partners that will be simultaneously developing the appropriate projects on a scale basis. Thank you.
We intend to be very responsive to the community in developing the housing program. Right now, we currently are proposing about 1,000 units as well, where we are fully committed to 30% affordable housing. We want to target a community that we believe has been underserviced, and that is our veteran community. And we also want to provide supports for our seniors as well. And so our commitment is to at least focus directly on those two segments of the community, as well as other subsidized programs.
Okay, we have time for one more question, but I'm going to squeeze in 3 because I'm going to do my version of a lightning round. MWBE program, are you going to have an MWBE program, and what is the target that you're looking for?
So I am a state and city certified minority woman-owned business enterprise. And again, I had spoke to this during my presentation, that it's far and few in between that you have large real estate developers who are committed so much to supporting the community that they have partnered with my company, and we are going to be the sole designated construction manager. With that, we are quite sensitive to ensuring that there is fairness and equity and equal opportunity for everyone during the construction process.
Do you have a target number?
We have at least at minimum 30%.
Okay, so what I need on this lightning round is a yes and a number, or no and no number. Doctor? MWBE?
Yes, but no number.
Okay.
Yes, certainly MWBE firms will be involved, and the number will be within the regulations and requirements within the law.
Okay.
Yes, we do, and it will be within the request from SUNY.
I have to say that I can't just accept something that's just what the minimum threshold required. This is a community asset. This city is over 50% minority, 100% minority ownership, MWBE ownership, 100% general contractor, MWBE, 50% on every single activity on that project.
Thank you. I need the 4 of you to answer, because one answered already in her presentation. Those who decided not to do a full-service hospital, can you just give a brief reason, 15-second reason why you thought that was not the right thing to do? And we'll start with you, Mr. Peoples.
We chose not to do a freestanding emergency room facility because it's not feasible, and a full-service hospital is not needed or feasible based on the statistics that we've gotten from the state and the guidance that we've been given on the RFP. So therefore, we chose to pick the best use under the circumstances and the parameters that we're given, and that's why we went with
Next.
Family Health.
A very similar answer. We did looked at the community needs assessments, the PQIs. We hired the health experts to tell us what was needed here, and the focus is on primary care. But one important thing that they did say as well is a freestanding emergency department, which we will have.
You gave me your
Our
answer.
proposal includes a full-service hospital.
We studied this extensively for several years. The trend is declining inpatient needs. We are seeing this now in Brooklyn at every single hospital, and we've concluded that there is no need for a full-service hospital. We have the appropriate set of healthcare services in our proposal.
So we studied the BHIP report and other surveys that were provided through us through the RFP process, and we are proposing emergency room as well as a need in the downstate area for the LTAC, long-term acute care, as well as supporting the elderly community with the skilled nursing home facility.
Yes or no answer. Have you met with community organizations on the grounds thus far?
Yes, we have.
Doctor?
We've had extensive meetings with community organizations, the unions, city officials, and people who know this even outside of the city to examine the trends and make sure we're doing the right thing.
Next.
Yes, we have, and we continue to pledge to meet with all interested stakeholders and community members. Thank you.
Yes to all of the above, the community groups, the political leaders, the unions.
Yes.